inform me so that we can start. Okay. Chat room. Yes, clear, Samreen. Thank you so much. Good afternoon, good evening, according to your time zone. Let's start our session. A tiny session for our candidates and our friends who could not achieve success in part 3 MRCOG exam today. My name is Mohamed Hassan, and I think most of you know me very well. Dr. Pooja Sharma is also in this room with us, and Dr. Zaib. We all will try to talk about the causes of failure. I don't like to call it failure because it is not like this. You have to understand the truth. There is no failure in MRCOG exams. It's not like this. It's just a marathon, and multiplayers are in this marathon, okay? And if you could not achieve the pass mark, it doesn't mean that you are a bad guy, okay? It doesn't mean that you are not in the form. All of this, that you have to improve your skills, improve your quality, and to maybe more understanding the standard of evaluation by the Royal College, okay? This is very important to be understood, okay? Depressed, extremely low, practiced so hard, don't know where I went wrong. This is the question. I would like to thank you so much, Samreen, about this question, okay? Because this is the first step to pass this exam. I would like to understand why I missed my trial. Why? What went wrong with me? Now, from my own experience for overseas candidates, one of the major mistakes, maybe not understanding the standard. You know, hello, just a second. Yes, Dr. Zaib, Dr. Pooja, I can see your names in the room right now. I would like to thank you so much, both of you, for being with us today. And Dr. Zaib, how are you?
Hi, assalamu alaikum. Good evening, everyone. And I might be sounding something like, different because I'm just under the weather spell. But thank you so much, Dr. Hassan, for such a good start. And yes, I mean, I would definitely agree with you that it's not like that if somebody is failing an exam, so it means that he or she is incapable of becoming a MRCOG, or if, I mean, he or she is not a good candidate at all. Okay. So it doesn't mean that, yes, I mean, I have been there. Okay. I have failed this exam. So I know the feeling. I know how hard it is to even, just listen to this word failure. But the problem is that, if we just accept our mistakes, if we just accept it as it is, and we just move on and we just, go forward. So I think we can ace it in the very next attempt. Okay. So all I can say is that, yes, it looks so hard. It looks so difficult and, the unacceptable as well. But the problem is that, we can't do anything. We just have to accept it, and we just have to improve on. Okay. And there is nothing wrong with you. Okay. Maybe perhaps, there is something you have missed in exam. Okay. Probably, the 1 or 2 key points, 1 or 2, silly mistakes, that can make a difference. So it doesn't mean that you haven't prepared well. It doesn't mean that, you are not a good candidate. Probably, I mean, it can be, something that you have missed in that, the particular time zone. So yes, and again, there is sometimes, the matter of luck as well. Probably this is not your time, but yet again, we just have to move on. We have to study hard, and we have to make it happen. That's it. Okay.
Yes,
So
exactly.
exactly.
yeah, Dr. Zaib, you know, we need to discuss the mood of studying, the type of
Exactly.
studying. You
Hmm.
know, I always use the term of revision. It's
Hmm.
not like a revision. It's not like to do the same mistakes, studying the same sources, reading from the same books, doing the same act. It's like
Vision.
re/slash vision. I have to see the situation from another point of view. Okay?
Hmm.
Because if you would like to do a change in your life and your pathway, you have to change yourself first. And automatically everything will be changed later on. Now, Dr. Pooja, again, yeah, I missed Dr. Pooja. Dr. Pooja, can you open your mic, please?
Hi everyone. Hello Hassan. Hello Zaib.
Hello.
Hello, Pooja. How are you?
I am good. I am. Of course, I would not say it's a pleasure to meet people. I know everybody is feeling down, and unfortunately, the kind of exam it is something which commonly candidates will face, and it's as everybody has said before me that it's not just the knowledge part of it. It is
Hmm.
basically how the things went on that particular day, and sometimes we all have bad days. I will say that it's not only, you may have even practiced well. I'm sure everybody gives their best whenever they go for any exam or any performance, but some days our mind also plays tricks on us, and once you make some mistake or there's some shortcoming in something, it plays on
Hmm.
your mind, and then the whole exam goes haywire. So that also happens, and
Yes.
most of the time it is only a very small difference between those who have passed and those who haven't. So it
Exactly.
may be just a very, one question or one domain or
Hmm.
two domains in one or two stations, which makes a difference. You have a cutoff and
Exactly.
you've crossed the cutoff, you pass, and you don't cross the cutoff, it may be by 1 point also, you are not able to clear the exam. So I know everybody feels, you've been working hard for so long. It is very difficult to book the exam. We understand that. This was not the problem in
Hmm.
our times. At least we
Hmm.
could book the exams, and now the backlog is such, and with the COVID happening for the last 2 years, there is a backlog. People are not even able to book the exam. So once you get to book the exam and you try so hard, and when it doesn't work out, it's understandable that people feel low. But
Yes.
uh, this is the last part of the final part of the journey for MRCOG. As I say, it's the final step. So you have reached here, and I'm sure you have to just cross the last hurdle. Maybe it didn't happen this time, but I'm sure it should happen the next time, because all of you are going to learn from what happened, and the exam is the biggest learning. I always say
Hmm.
that I always felt the most knowledgeable after an exam, because then you understood what
Exactly.
happened. So whatever you have learned now, once you have appeared there, I'm sure next time you'll be more confident, you'll be more clear about things.
Hmm.
So I think instead of us speaking, if anybody wants to, because
Share.
I know you people may have analyzed what you did in particular stations. So where do you feel there was some lacking, or if you analyze your own performance, what do you feel you need working on? I know everything you may not understand, and everything nobody can understand. Sometimes some things happen which are beyond us, but what are your thoughts? Anybody wants to speak up, then maybe we can give our inputs based on our experience. Of course, I don't say that we all are like very, we know everything, but we can maybe, and sometimes, listening to other people gives you very good ideas. Listening to
Hmm.
You
people
know,
not only
you
tell about
know,
the exam, not only tell about the clinical part of it, or the theoretical part of it. Sometimes somebody says something which goes into your brain, and it really works, and it has worked for me. So I invite people, I know, whoever wants to speak up, wants to talk about their experience in the exam, or what they think was the problem. So I think Samreen has messaged something. You want to say something, Samreen? You can unmute yourself and talk.
yes, you can open your mic, Samreen, please. If you would like to do that, of course. And Children around, yeah, okay, I can imagine. So, yes, exactly, Pooja. It's a matter of analyze paramedical problems. It's very important to understand. Here, Samreen said it's a technical. She faced some technical problems, and I think many of candidates are suffering from the same problem. And I was in a training, re-evaluational training for examiners by RCOG on 3rd of December. I mean, maybe 2 weeks ago. And I realized that the evaluation, the examiner's marking sheet is somehow very difficult, believe me. So even people who pass the exam, I'm sure 100% they missed a lot of points. That's why maybe the pass mark is low. I can remember on my days, 2017, the pass mark was higher, very high, okay, rather than these days. Now, the exam is very difficult. The standard changed accordingly to improve the quality of the exam and to be sure that all candidates are facing the standards. So you have to understand what are they looking for. You can imagine that the exam by the RCOG committee of part 3, they said frankly, exam is about 20% of knowledge, only 20%. So for example, when you are trying to prepare for a further exam, don't waste any moment in revising knowledge, because you passed part 2 and you studied before part 3 knowledge very well. So don't waste your time in revising guidelines or something like this. The exam is only 20%, stressing on knowledge, and 80% looking for other points, like the communication skills, like difficult situations management, like how can you negotiate with either examiner or role player. So you have to improve your qualities in these points rather than reading guidelines, revise points. It's not like this. One of the major mistakes by overseas candidates, and this is maybe related to their primary studies. The primary studies, I'm talking, for example, from Egypt. In our exams in Egypt, we used to memorize everything and to talk a lot and to express every single knowledge, information in our brains. This is a very, very important mistake. You know, in the MRCOG exam, when I'm evaluating a candidate, if the candidate is talking too much, trying to express every single information, I will give borderline, because one of the major parts of communication domain, for example, is to listen appropriately to the patient. Listening more than talking is critically important in evaluation, okay? So what I believe in, that all of you are dealing with the exam, like I have to show the examiner how much I'm knowledgeable, how much I'm efficient. It's not like this. Efficiency is not related to the knowledge. Efficiency is a multi-domain perspective, okay? So what do you think, Pooja and Zaib, around what I'm talking about?
Yes, exactly. I mean,
This is a
100%
very
second
common
to.
mistake, Zaib, I think. Am I
Yes,
right?
yes,
This is a very
yes, yes,
common.
yes, it is.
I
It is.
noticed
It
this
is.
when we are doing the circuits and when we are doing the training.
Exactly.
If I can come in,
Yes,
Zeb, you
yes.
want to You were
No,
speaking
no, no,
something.
please, please. Go on. Yes.
So I feel is now that we are doing so many, everybody's attending so many courses and so many group sessions everywhere. I think the emphasis is more on, you know, the rote words now. It's becoming more and more, you know, I have to speak these particular lines. Of course, you have to speak some lines in each station, but I think the more emphasis is made on that, and then the whole mind is diverted towards those specifics only. And then, you know, the stations change. You know, there may be minute differences, or even if they're repeated, there might be some differences in the station coming from one exam to the other. And when
And
we are
there is
and,
difference, and there
yeah,
is.
and then we are overwhelmed with what you know, what you have heard, and this is the particular template. I know everybody keeps
Exactly.
asking for templates and all, but I feel that when you are overly dependent on these things, when the question is asked for you in the exam, you cannot modify it very easily, because your mind is always telling you, okay, I have to speak these few things, but it may not be relevant, or that particular question may be demanding something else, and then that thing is lost. You know, instead of, like, if you compare it, when you are seeing a patient in your clinic, you are actually responding to what the person is saying. Instead, in the exam, you have decided, okay, this is a station on, say, premenstrual syndrome, so these are the things I want to speak. Of course, you must remember the salient points. I don't deny that, but I think it's an over dependence on one particular way of speaking a station, which also can affect the things. You all can think about it, whether that kind of thing is affecting your. I think that is one of the things which may be affecting, because we are because if you remember, Zeb, we never used to have all these templates at the time.
Never.
We
You
used
remember,
to think,
exactly.
never.
We used to fight, we used to think, we used to discuss. And I still remember we had only one group for the part 3, remember? And in
Yes,
that group, we all used to be active. You, me, Fauzia, I still remember, and so many
yes,
other
yes.
girls as well. And we used to discuss till late night, and we used to say that, okay, what do you think would be the good answer? What do you think that could be? So she used to say, look, I have searched this thing from this template, and I think this can be a good sentence to be used in the exam. So by the end of our preparation, I think we were in a good position to even talk in a free mind. But these
So
days,
exactly.
sadly, exactly, what happens is that everybody is after, can you please give me your lines? Oh, come on, you can't be me. I can't be Pooja. Pooja can't be anybody else. Okay, we are ourselves. Okay, we are unique. I mean, we do have unique personalities, isn't it? So if we start speaking like, I mean, everybody in exam, so what will be the impact on the examiner? And what will be the impact on the ongoing exam as well? So
Yeah, because
I
we used
think
to develop our own lines. Of course, you listen to
exactly
somebody, and you can use the lines, you can use the basis of what they are saying,
taking,
but you
yes.
think, and you know, it seems more natural when you're speaking your own lines. It becomes more natural. It is, and then you are more confident also, because otherwise you're trying to recall the things you have learned by rote, which
Exactly.
doesn't work in this exam. It has to be a conversation. I always keep telling, you know,
Hmm.
it is a conversation between the patient and the doctor. Of course, it
Hmm.
is an exam scenario, but it has to be a conversation. One
Hmm.
person has to listen to the other and react to it. When you are all, when your mind is focused on one particular thing, that this is the template I have to speak, you will not be able to think. There are only 10 minutes there.
Template should be for, you know, the structure. I mean, it should be like, I mean, a structure that, okay, this station should be done in this way. That obviously, you know, what we are used to of it. Whenever some patient come to our clinic, what we do greet, isn't it? We do say good morning, good evening, if you know that is the condition. Then we do say, you know, that, I mean, can I know, I mean, how can be of, you know, help to you? So this is what we do say, isn't it? And thirdly, I mean, we do ask, I mean, okay, so then we go about, you know, the presenting complaint, then history of presenting complaint. Then we do go for examination, and in examination we do the same, per abdominal, per speculum, per vaginal. So this is all you have to do in real exam as well. So I mean, I don't think that this is such a hard thing that, you know, we have to face in this thing only. That, you know, we need some kind of set templates or something for this thing, that, okay, I mean, I do need to examine you in the presence of chaperone. So yes, I mean, we can say that, I mean, if condition applies, but not in all cases, I must say. Okay, so
Yes.
I think, I mean, what candidates do is that, you know, they have learned this phrase. Okay, although this is such a beautiful phrase, and this is such a, I mean, good phrase, but it doesn't mean that, you know, we have to imply this phrase in each and every scenario there is. that, you know, I have to examine you in the presence of chaperone, then I would like to do some investigation, then I would like to involve my consultant, then I would like to, oh my God, you are taking 2 minutes in liking, liking, and liking. So it means that you are losing your two precious minutes just in this thing that, you know, I would like to do this, I would like to do this. Okay, go on, go on. So you would say, I mean, in simple words that, okay, so this should be the structure. There should not be a set template for any, I mean, the station or the any topic there is, but there should be a structure that, okay, if somebody is coming, I mean, what happens in our clinics, okay, if somebody is like, I mean, running a clinic, so I mean, we do see variety of patients, isn't it? So it's not like, I mean, we are going to see just only today is the ops day, so we will be seeing only anemia, or thalassemia. No, we do see so many, you know, the different types of patients. So that likewise in real exam, it happens the same way, isn't it, Pooja, Dr. Hassan? So I mean,
Yeah.
we shouldn't be this thing fixed in our mind that, okay, we are going to talk in that line what we have been taught. Okay, taking inspiration from anybody is perfectly fine. We are also inspired from so many people, isn't it? So it doesn't mean that we are going to be like them or we are going to behave like them. Okay, so I mean, if I am, you know, speaking, so this is me, Dr. Zaib only. If Dr. Hassan is saying something, so Dr. Hassan is, Dr. Pooja is there, Dr. Pooja is Dr. Pooja. That's it. Okay, we can't be anybody, so stay natural, stay as, you know, natural and as, you know, spontaneous as possible. I think
You
this should
know,
be the first rule.
yeah, Dr.
Hmm.
Zaip, you know, I was
Yes.
responsible for a session in the regular large course of Med Exam Part 3, and
Mm-hmm.
I was responsible for the session of templates to be used in the
Mm-hmm.
exam. Okay,
Mm-hmm.
the aim of this session was mistakenly understood because the candidates thought that they have to print these templates and build
Mm-hmm.
on their works on it only. But actually,
Mm-hmm.
it was an example to help them and to direct them how can they build their own templates to finally reach their own character inside the exam. Okay, this is the aim, is not to be a copy of any good mentor or any good friend who passed the exam,
Yes.
because it's
Mm-hmm.
impossible. I will forget many things if I
Mm-hmm.
try to act like Pooja, for example. Okay,
Me
she's
too.
better than me and she's more professional than me. So if
Not
I
at all.
tried, no, if I try
No,
to act
she is
like
more
her,
spontaneous,
I will
mashallah.
miss a lot of things. So what I'm trying to
Exactly.
do is to do it by myself. Okay. Another very important point. Nobody will help you like yourself. Okay. This is what we are saying in teaching. It's a problem of spoon feeding candidates. It's impossible. Okay, we are not going to prepare for a primary school exam, so I can help you 100%. I only can direct you, help you, and giving you tricks, some sentences to help, some ideas. We can solve difficult situations together, but 100% your work will be your key to pass the exam. So don't depend 100% on any courses or any help, any mentors, anyone. This is a very critical point, because I know the mentality of why UK trainees can pass the exam in a very easy way in comparison to overseas candidates. It's not like because they are working in the UK system and they understand everything is available. If you don't know anything about any topic, you can Google it and you will find it very easy. The
Yeah.
knowledge are available everywhere. So why they pass the exam? Because they are dealing with the same situations every day by every mood, by the same mood. So in the
Dr. Hassan, we
exam,
do the same, isn't it? In our hospitals as well, because we are also doctors, we are seeing the same patients. I think as an overseas candidate, the major flaw is that, you know, first of all, like, I mean, we all have said that, you know, we blindly follow, okay, somebody, or we just try to be somebody. So,
Exactly.
like I said, that, like, I mean, because I'm on leave because of my sickness, but the last, on Monday, when I was in hospital, I had variety of patients. The first patient was 13 year with amenorrhea, okay, and the, 13 year with HMB as well. Then I had, the 40 years with HMB. Then I had, with infertility. Then I had, 2, 3 OPS patients. So variety of patients, isn't it? So we do deal with them. All
The
we have to do
problem,
is that. Exactly.
the problem is in the mentality. If you deal with this
Hmm.
exam like you are going to your private clinic, and
Hmm.
you would like, and you will see 14 patients,
Hmm. Hmm. Hmm.
not you are going to the exam, you will pass the exam. The second
Mhm.
very important point, Dr. Zaib, you mentioned, like, now you so many cases, okay?
Yes. Hmm.
So the candidates, the overseas candidates, are very professional in knowledge. There is no problems in knowledge. Now, the problem actually will be in the communication skills. Okay, so this is the point they should work on. And this is the new revision about the preparation of MRCOG Part 3. Another very important thing, I think it's you and Pooja will agree with me about this. The stress, the
Hmm.
stress. I will give you a very, very clear example. I was in UK 2016 and 17. And then when I was there, I attended a course for Part 3 MRCOG preparation. I was sitting in the last row. When the instructor asking who would like to do this station in front of people to just to train, I'm just hiding, okay? Because I felt that I should not do mistakes in front of people. Now, the UK trainees, they trying to take the trial, and they presented badly.
Hmm.
They failed the station, and then they accept this situation by smiling, by saying we will do better next time. This is a very critical point between the UK people and other people. We all suffered from the point of we should pass. We need to pass. This is put us in a very burden situation. When you are getting inside the exam, I'm so much afraid to fail the exam. I have to pass. I did a great job in studying, a lot of hard working. I paid so much money. I am in need to pass. All of these points doing a lot of burden on your mind and your performance. This is a hidden stress. You should overcome it. You should trust yourself. My always sentence to all candidates: did you hear before about MRCOG candidate who passed part 2 and get inside part 3, and then they failed him 4 times and he was executed from part 3 to repeat part 2 again? I never heard about
Never.
it.
Hmm.
Never. What is that means? It means you will pass this exam, inshallah. You will pass this exam.
Hmm.
Later or soon, you will be MRCOG. It's a matter of time, okay? So be calm. Trust yourself. Trust your actions, because anxiousness is your great enemy in this preparation. Am I right?
Okay, I want to add something because I am in Singapore, and the Singapore trainees also give the MRCOG. That's their passing exam, like UK. So Singapore trainees will have to pass MRCOG to exit and become consultants. So they do give the same exam. So I have been in the last 2 exams, I've been part of the faculty teaching the local trainees here, the Singapore trainees. And they never speak the rehearsed sentences. They will always talk very naturally, as they would do. Of course, they follow they have an advantage of following the similar guidelines as UK follows. So they are well versed in dealing with that in day-to-day situations. But when they're speaking in the exam, of course, nobody is perfect in the exam, but they're not saying the rehearsed lines. It's very natural. And they do very well. Most of them, they pass in the first attempt. Of course, they have examiners also who, from Singapore only. Most of the examiners are from Singapore, but now it is an online exam. So of course they had some other examiners as well. But I find that they are very confident, and because they're very natural, they're not trying to speak out rehearsed lines. And this is an important fact, because earlier I was only exposed to the overseas candidates. I myself being an overseas candidate. So, but these people are trainees. You should know that Hong Kong and Singapore trainees who are doing gynae and obs have to pass the MRCOG to exit or to move forward. It's like our MD exam, like in India, we give an MD exam to become a gynecologist. They have to pass the exam. So they're all giving the MRCOG exam. That is not by choice, it's by design. So the important thing is that they, of course, the clinical knowledge, everybody is the same as that. So there is no difference. You all read the same guidelines. You have already passed the part 2, which I feel is the most difficult part of the MRCOG, the part 2. Because part 2 requires a lot of in-depth knowledge. You have to read between the lines. You have to be very thorough with your guidelines and the knowledge to actually solve, especially the EMQs. But part 3 is much simpler. But sometimes, of course, what problem we face is maybe because English is not the mother tongue of most of the people who are in this room, including us. And we are not very confident in communicating. And especially when you are thinking that you are also thinking about the accent that person will have, whether they are able to understand you or not. So there are a lot of things in our mind, because people keep asking nowadays. Earlier they used to ask, now also they ask, whether this center is good or that center is good, whether the role players will be speaking in a particular manner, will they be able to understand us? So that all anxieties are there for everyone. It was there when we gave the exam as well. So important thing is, I find some of the people, and most of the people in the subcontinent now, many of you are from India, Pakistan and all, and we speak very, very fast. Okay, this is a problem with all of us, including myself. We speak very fast. So in the exam, an important thing to consider is, of course, it's very difficult to speak slowly when you are very excited, but when you are practicing and when you are discussing the stations, try to be slow. Because you have to understand that the role player, and corollary of that is the examiner also has to understand what you're speaking. So if you're very fast, they may not ask you to repeat the things, but they may miss the points you're speaking. So, and again, that also stems from the fact that you need to be a little more calm in the exam. So you have to be slow, calm, your tone and everything. These are the things to learn. The knowledge is not for us to teach you. The things to learn are how you are speaking. So you see that now I am talking slowly to you. Now when I'm speaking slowly as compared to what I was speaking earlier, you understand it better. So we have to modify our speech in a way. Of course, it's not very easy, but it comes with time. And as you keep doing, it comes. So you have to be calm. Yes. So this is, of course, you may have problems in a state. Everybody will have problem in 2 or 3 stations in the exam. Everybody will think that this station was very bad. There are few stations which are coming for the first time, which nobody knows about, and they are very strange ones, or very shocking stations which nobody knows. You do not lose heart, because everybody is going through the same thing in the exam. Don't worry about that. You do the things
will
which
be difficult
you know.
for everybody, isn't it?
Yes,
and
it's actually like part 2 exam, Pooja, it's like part 2. I can see every single candidate in part 2, just after finishing the exam, start crying. It's very difficult. Unbelievable questions. And I said just one word, please.
And nobody knows. Nobody can say that they have passed.
Yeah, I just say, take a deep breath, and tomorrow try to revise the questions in your mind. You will find them repeated questions, easy questions, even very, very minimal questions are difficult. So this is the regular psychological problems regarding the MRCOG candidates and exam. You are definitely right, entirely right.
Exactly. And on the other hand, the candidates who, couldn't be able to go through this time. So, all you have to do is that, sit back, reflect on yourself. Okay. I'm sure you know what reflective practice is, okay, from part 3 and part 2 as well. So, what you can do is that you can just reflect back on yourself, that what you have done, what could have been done, or what could have been done more to pass this, the exam. Probably I don't say that it's all the time that you haven't practiced well, or you have left something, but there can be something that which you could have done, in a more good way to pass this exam, isn't it? So what when I failed my exam, so I sat with myself, okay, so I just reflected back on my the exam again. So I did try to recall whatever I have done in the exam. So then I found out that perhaps that I had to do something good in one or two or three particular stations. And then I came, because when we come out of the exam, we are so overwhelmed, and we are so under that kind of spell, that if we have done almost like 9 or 10 stations in a very good way, and according to us we think that okay, this is going to happen, and I'm going to pass. But what about 4 or 3 stations which you haven't done, or you haven't performed well? So yes, perhaps there can be some kind of the gap in your the performance on that day, not in the preparation. Okay, so just sit back with you, try to reflect on yourself, what you have done and what could have been done more, okay, to improve on yourself. So I think this way only you can just come across to this thing that okay, I need to cover that the gap in my preparation this time. So yes, probably in the next attempt I'll be in a good position to pass this exam. So this is my thinking, and this is what I have done with myself, and I think it worked. Because when I failed,
You
the
know,
pass marks were same 62%, and I failed with 60%. So yes, I
you
can
know,
feel the pain. Yes.
Zaid, let me give a very small clue about the exam mistakes and how can we pass it.
Mhm.
I passed from the third time, okay, and I'm proud of that because the 2 trials of failure gave me a lot of experience regarding this exam. I failed the first time because I tried to give the all people in an exam too much knowledge.
Mm.
I talked a lot. I never gave the candidate or the role player a space to speak. Now, in the second trial, I changed my policy. I tried to be so cute and I tried to be familiar with
Which
the
you are,
candidate,
in fact.
and I missed giving knowledge. Okay. So in the first trial, I failed in knowledge. Sorry, I failed in communication skills. In the second trial, I failed surprisingly in knowledge domains. Okay. So finally, I found the good equation to pass this exam between the knowledge and communication. What is this equation? This equation is, in SPTs, my target is the patient, not the examiner. And in SDs, my target is knowledge. This is very simple equation, okay? In SPTs, you have 3 or 4 stations with lay examiner. Lay examiner will give you big fail if you are not aware about the communication in these stations. My Egyptian friends, before going into the exam, I'm always saying to them, if you get inside the cubicle or a station online, whatever, and you notice 2 examiners, start to change your mind away from expressing your knowledge to be focusing on communication. And the basic part of communication is to listen more than talk. This is how can you pass the exam. I'm saying that because I just noticed Pinky's messages on the chat room. This is very important, Pinky, and everyone to get this point. try to be smart enough. When should I do very good communication, and when should I express my knowledge? This is critically important for this exam. Am I right, Zaib?
Yes, yes,
I failed
absolutely.
twice because I could not do this equation correctly.
No, I 100% second you. And absolutely, I mean, it should be done like this. And on the other hand, because I had, the opportunity to be an examiner in 2021. So what I have noticed so far is that, because in first exam, I had, the local trainees, UK trainees, okay? And the second exam as well. So in the first exam, the what I have noticed, the difference between the UK local trainees and the overseas trainee is, despite the fact that they are very good in communication and everything, but they do miss many things. Okay, like all overseas candidate. Okay, they do miss. Okay, in terms of knowledge and even in terms of communication as well. So never think and never assume that you are less, knowledgeable, or you are less capable of going for this exam, okay, than the local UK training. So it doesn't mean that the one who is like, yes, they may be fluent, they may be using the very right sentences because they are doing the same on their daily basis. But yes, as an overseas candidate, because we do work hard, and we practice a lot, and we do try to match them as well. So we are no less than them at all. Okay, so never think like underconfident that you can't do this, and you can't perform well in exam. So don't think like that. Okay, so I think back in 2018, remember, Pooja, when we were in UK, in London, right? So we gave face to face exam. Okay, so we gave face to face exam, although I have failed that the trial. But yes, but we were in London, and we were like, almost with everybody, I think. And at that time, there was not used to be like, separate exam for UK trainee and overseas. No, it was like kind of, the mix. So we never thought, and we never felt, low in terms of this thing that, okay, we can't pass this exam. See, Pooja has passed this exam, and many of our friends have passed in that trial. So it
So
doesn't mean that, yes.
I have something to say about that place. If you remember, we had gone for a course. I
Yes.
had only attended one course there, which was the
Yes.
teal fanning course.
Yes.
And I had a UK candidate there. She was a girl from Hong Kong who was based in UK, and she was working there as a resident. And she was the one who was like perfect in that the course. Okay, so whatever she presented was excellent. And when I was looking at her, I was feeling that, oh, if this kind of candidates are there, I cannot pass the exam because I'm nowhere near her, because her knowledge, the communication skills were excellent. She was a UK trainee and then giving the exam, and very good, and her communication skills were excellent. And she gave the exam with us. So I think she was on the same day or some other day with me. And to my surprise, because I got in touch with that girl because I was sitting with her, there were subgroups in that course, and I was with her in the subgroup. So we exchanged numbers, and I was in contact with her when I came back. So fortunately, I passed in my first attempt, and it was very surprising for me that the girl did not pass the exam. So sometimes you look at people and you think that you are not doing well, and then you feel bad about it, and then you lose confidence, and you should not do that, because things happen. I passed the exam and she did, and she passed in the next attempt. Of course, she was very good, and I still say that she was a very good communication skill. She knew knowledge she had, but something happened during that day when she could not. There were some misses, may have been some misses, and she could not pass. So what I say is that whatever other people are saying is the same thing. So sometimes when you are studying in groups also, like you have many Telegram and all those groups, and there are discussions going on, you're listening to other people, you may feel that you don't know that much, or your performance is not that good. Even in the course, when you listen, you see some people are more confident, some people are a little lesser confident, but that's okay. Everybody has their own journey of preparation. Some people will just speak at the end. I used to be in these groups which Zaib is talking about, and there used to be people who had given the exam earlier, so they had very good idea about the exam. So when they used to speak, I used to think that, oh, they already know everything, and they are much, much better. And I would not have the confidence to speak also in front of them because I was not well versed with how you speak, because this is a kind of a learning which you develop when you are preparing. But at the end of it, I did pass the exam. So it's not difficult to pass it, but you have to be a little smart in the exam. You have to have a strategy, and that strategy has to be more discussion, and you should have a group of people who are discussing among themselves. I attribute my success to my study partner. Okay, I had one study partner which I met in one of these study groups, and she was from the same place as me, so we could time our discussion. So this, which we call as a study buddy or study partner, and then we used to practice stations together. I think that was the main reason I passed the exam. That is my taking on it, not any course, nothing, because hardly that time there were hardly any courses.
Yes,
We
exactly.
just went to one course in the UK, and I don't know what we learned from that. That was just 10 days before the exam. So
Yes.
of course the courses are important. We learn a lot from the courses. Now you have that advantage of having so many good online courses happening, which people tell you everything. We never had that thing. But what you do on your own end is as important. So if you have a group, one or two or three people who study together, maybe once or twice a week, regularly, and who are honest and critical in their feedback, it's good for you. Because you cannot be always dependent on a mentor giving you feedback all the time, because everybody is doing so many things. But if you have a group of people, when day to day you can discuss and feedback, it is good. Of course, the courses give you the basic information. The courses will make you one step further than what we were at that time, because we knew nothing. Now people know. So you have a basic knowledge of what the exam is about. You have the basic tricks which you use in the exam. Everybody's there to give you that. But later at the end stage, what differs between one candidate and the other is that confidence in speaking, or maybe some things happening. And of course, I still say the day is also important. So sometimes the day is not yours. So you cannot just blame it on yourself. Sometimes it happens.
I would say the same. I would say the same, because everybody prepares, everybody, goes well prepared in exam. But obviously, it's sometimes, like I said earlier, that, it can be because of, some points, some maybe, any key mistake, and perhaps, that was the examiner key at that time. So when you fail to, come to that examiner's key, so then yes, whether you have performed so well or not. So I think then it's going to make any kind of difference. But otherwise, obviously, when we are preparing for this exam for such long time, for few months or something, so obviously we think that, we are well, prepared, we are good to go for this exam now. And yes, obviously, and again, the same, probably, that was not your day. And perhaps, in the coming exam, you will pass. But again, I will, I will repeat the same thing. Please reflect back on yourself. Okay, reflect back on your, what you have done. Okay, because you yourself can be yourself can be a good critic for your own self. Okay, for your own preparation and anything what you do. Because I don't know you 100%. Okay, I never know that how somebody has prepared for this exam. Okay, if somebody has taken my course, so he or she will be with me for like 3 months. Okay, and in 3 months, how many times he or she presents. Okay, that is just going to show me the half part of his side. Okay, the other half I don't know much. Okay, so you have to prepare very well. Okay, like Pooja said that courses are going to help you. Certainly yes. Back in 2018, when we gave our exam, we didn't have any kind of support in terms of online courses. And the online courses, I don't think, I hardly can recall. Okay, and we didn't have even idea. Yes. And these days, when there are, superb mentors, when everybody is trying to, give you ideas about exam, trying to take out time to, make you a good, the candidate for exam. So I think, take advantage of that course as well if you are in. Okay, do try to get, whatever good point you can get out of this, the course, or out of, any particular mentor, but don't try to imitate. Okay, like I said earlier, that getting inspiration is something, and being or copying somebody is something. Okay, So get inspired, okay? Do try to take positive things out of me, out of Dr. Hassan, out of Dr. Pooja, and anybody there is, okay? So yes, I mean, you can go for it, all right? Because of losing confidence back in 2019, I want to ask this. Yes, lack of knowledge and preparation affects the confidence as well. Okay, so if you think that you haven't revised, like I mean, for example, we know the syllabus, isn't it? Okay, we know the syllabus, and we know that okay, these type of these stations are must which can come in exam, okay, because we have got 14 modules, and by the time we pass our part 2, so by the time we are in a good position to understand that what RCOG wants and what are the hot topics for the RCOG, okay. So obviously we can't miss those topics. And apart from that, like I mean, there are plenty of mentors guiding you around, there are plenty of seniors guiding you around. So what you can do is that you can take help from them as well, okay. So yes, syllabus is always there, so you can't miss so many important things. For example, for me, let me, because I can give only my example, because I have failed this exam, I have passed this exam, so I have both the experiences for this exam. So when I have failed this exam, so I knew myself that I got tired after like performing 12 stations. While I reached at 13 station, I was like half drained. I was like, I can't do this exam, okay, I can't do this, the further 2 stations. So all you can do is that first of all, don't get tired in exam, okay. Don't just think of that if you haven't performed well in the previous station, you can't perform good in the upcoming stations as well, okay. So don't give up. For me, the basic mistake was that I almost gave up, like I mean 50 to 60% in like I mean 13 station. I said I can't do it anymore. And by the time I reached at station number 14, somehow probably because the examiner was also tired, okay. Probably I was tired and I was seeing everything so tired, and the station was also very new to me because I didn't do that station at all in my whole preparation. So obviously I lost that exam, even with the very close marks, but still I have lost the exam. So what I did was that when I started preparing for my next attempt, I started with that the station or number 14 station which I never prepared before. Okay, and that was in neutral transfer. Okay, that was in neutral transfer. So at that time, I was thinking that okay, I have to start my preparation within neutral transfer because I didn't do well. So what I did was that I repeated again the 14 stations with me. I did try to reflect back on myself that what I have done and what should be done at least, okay, to pass this exam. So I will say again that don't be underconfident, don't be overconfident. Lack of knowledge and the communication skills sometimes it does make difference, okay, because applied clinical knowledge is a part. So side by side when you are doing the stations, so for the candidates I must say that how you are going to align your the preparation now onwards is that I mean it's better that you start preparing yourself from now onwards, okay. For the November people, there is going to be May exam, isn't it? So I think 5 months are more than enough to prepare to take a fresh start again. So what you can do is take things slowly, and then gradually you can increase. Like I mean in the start you can do uh, you know 4, 5 or 6 stations very well, okay. um yes, Sunita, yes, I will definitely, okay. Soumya, yes, I can imagine, Soumya, okay, because I have failed this exam. I have been telling you 62 was passed and I scored 60%, exactly like you. 59 and 60 doesn't much difference, okay. um I think that yes, I mean there is matter of one or two station perhaps, or one or two key facts. That's it. Okay. So it doesn't mean that our preparation was not up to the mark, or and we were not the good candidate. But it may be because of we have missed something in the exam. Like I said that I admit my mistake that I got so tired in station number 13 and 14 that I really wanted to leave because I got so tired, okay. And I just lost myself at that time that I can't do it, I can't do it. And in station number 14 I was just like I mean kind of numb, and I was thinking myself that I am tired. The whole world is tired in front of me, okay. So it is very natural. So don't give up in exam, okay. Fight for each and every station, fight till, the last station. Even if you haven't done, the well in previous station, fight till station number 12, 13 and 14. Okay, so don't just give up at all. And
Okay. I want to answer.
Mhm.
Zaib, I want to answer the question which is
Yes.
come now about the structured discussion and how the examiner. Somebody asked about the examiner looking very angry. So the structured discussion, most of the examiners, 99% of the examiners will not give
They
you.
will
They
look,
will have a blank look. They will not
ask
give you any
patients,
idea
Pooja.
about whether your answer is right or wrong.
Yes, that
Okay,
is
they
going to
will
mark
not.
this.
Don't expect the examiner to make gestures that you are okay, you are going in the right direction or not. This is the basic fundamental of structured discussion. You
Exactly.
just have to say your answer. They will not give you any expression. Please remember, all of you, you should not expect the examiner to give you any idea. Don't think they are angry, don't think they are sad, don't think they are happy with your answer. Their job is they have been instructed not to give any expression.
Exactly.
They will just wait for you to complete your answer. They will go to the next question.
Yes.
That's what they're going to do. And whatever marking they do, it is at the end of the, they may be writing something or they will be writing something, the marking is done at the end. So please don't bother about how the examiner is looking at you. They are not angry at you, please.
Yes.
Don't
Nobody
lose
is angry,
confidence. Yeah, don't lose confidence based on this. Because if you lose confidence, then your not only that station, your next station is also gone. And we don't want that, correct?
Yes, yes.
So,
nobody wants that.
So just you train your mind that the examiner is going to just look blankly at you in a structured discussion station. In a role play station, whether they are looking at you or not. I never looked at the examiner in the role play station. Don't bother about the examiner there. Just look at the role player, talk to the role player. Whoever else is sitting there, they're just observers. None of your concerns. But when you're talking to the examiner in a structured discussion station, talk as you would talk to your consultant. You are the registrar there. Talk to as you will talk to a consultant, but don't expect any reactions from them. This is the one tip I will give for this.
Yes, and they won't appreciate, they won't say anything, if you have said something, they're not going to, appreciate it. Oh, well done, my dear, you have done, perfect. No, nobody is going to tell you that, okay? Because this is exam and they just are here to give you, that look just to, in terms of exam, that's it, okay? So, they are not our relative, they are not our, the kind of, rivals as well, okay? So examiners are very neutral. So keep this in your mind that, nobody can, the fail you on this, only this thing, okay? This is just only performance. So perhaps, 1 to 2% can be sometimes, 1 to 2% I can say, and probably that can be even more. There can be chances of bias as well, but not more than that, okay? But
and
what I have
actually that this way your exam differs from our own exams which we give for our graduation and post-graduation, because there the examiner may be nodding their head or giving you some expression, but especially in the MRCOG exam, I've never seen an examiner responding in any manner. So this you should keep in your mind when you go for the exam. This is very important. Okay.
Samreen, regarding your labor board, I would like to add one thing is that, I have, spoken to so many candidates after exam, and I know you had almost, 10 or 12 rooms. And out of those 10 or 12 rooms, I think 4 and 5 words that, the patient is yet to arrive, patient is yet to arrive. Okay. So it means out of them, you just had to prioritize and you just had to manage, like, hardly 5 or 6 rooms, isn't it? So I think if you feel that, this was the concern that your examiner was asking you from the other room, so you can write back to college. And I think after every exam, they give us a feedback email as well. So if you have any concern, so you could have written it down and you could have sent it to a college as well. I think college is fair enough in this regard that, they will just go because the online exam is all recorded. Okay. So everything is on, the record. So if you had any kind of concern, you could have, raised it at there and then. What do you think, Pooja?
Yeah, I think the other thing is that you see as in our clinic day-to-day life, and when you're in the hospital, you are ready for any situation happening. The exam is testing you for that. So the examiner may ask you, okay, maybe that the examiner didn't hear your answer or something, Oh, they are also human beings. They are also sitting there for the 3-hour exam. So if they ask you, you should not be hassled. You should, I think all changes should be just taken in your stride, because this is how life happens. You know, nothing is like very perfectly will happen according to the plan. So that's what they are checking also, you know, that how you are responding to the changes in the situation is what I feel. So yes, so the patient, this happens in the labor ward, you know, you are expecting a patient doesn't arrive, and there are patients who are there. So basically, if you can justify what you're trying to say, no, it may not be exactly right. That's what also, that's what also important, because when you talk about communication, they're looking at the confidence of the candidate. Maybe the labor ward board, what your prioritization you've done may not be exactly equal to what they're expecting. But if you can justify the thing, that will work for you in the exam. Is that what I feel? They would mark you.
And regarding Shri, to your question, that examiner was asking me, unfortunately, I went into flow of emotions. Only one word he was saying, yes, what else? Okay, now let me give you this tip. What else means that you have said each and everything, and now he just wants to ask you what exactly is in his keys. So probably if you say something, okay, regarding that, what else, with regard to that particular, the scenario, so perhaps, he just wants to listen to that particular thing. That could have been the buzzword, that could have been the keyword for you to pass this exam. Okay, because as an examiner, when we get our answer sheets, so we do have buzzwords as well. Okay, so I'm sorry, I won't be able to tell you guys that, how this thing works, but yes, I can just vaguely
Sorry.
tell you that we do have,
Yes.
3 to 4 keywords. And if somebody doesn't say those keywords, so it is clear fail. Doesn't matter,
Dr. Zaib, sometimes, especially in SDs, the examiner is trying to prompt the candidate towards the right pathway in answering the question. So if Samreen, if your examiner asked you about room number 3 while you are in room number 5, he or she actually is very kind. He's trying to help you to pass, to give you pass. And then you have to respect this point and you have to revise your answer in room 3, okay? I know sometimes this is maybe confusing to the candidate, but the RCOG are clearly instructed the examiners to prompt the candidate up to 3 times in the structured discussion, okay? After that, the candidate may take borderline or fail, but the examiner should prompt the candidate, especially if the candidate shows good performance. This is the instructions to us, I mean to the examiners, okay? So you listen to me, please. If the examiner in SDs asked you certain questions apparently away from the point, please answer it clearly, because he is trying to help you. As same as the role player in the SBT. In the SBT, I saw many candidates, they are trying to ask in the information gathering, history taking. They are asking. And then the role player may start to talk about something, particularly in the history taking. The candidate is keep questioning and stop the role player from talking. This is a major mistake. In SPTs, you have to listen carefully to what is the role player is talking about, because the clue of the station is in these sentences. One of the most important things that most of us as candidates, we are going inside the station and dealing with the station from our point of view. You are answering the station from your agenda, while actually you should answer the station from the patient's agenda. And how can you identify patient's agenda? By talking, by listening to what is the patient is talking about. If you cannot give her the chance to talk, you will miss the clue of the station. And this is a very common pitfall in the exam. For example, if I told you that the station is about PCOS, okay? Now the first thing will jump into your mind that PCOS, anovulation, she's seeking fertility. So you will start talking about these points. While actually, the problem may be simply related to amenorrhea and the woman is asking for regular cycle treatment. Simply, or withdrawal treatment. She heard about the risk of endometrial cancer in PCOS and she would like some counseling. Now, you will never realize that the situation is related to endometrial cancer risk unless you let the candidate talk and direct you, okay? This is very important in SPTs and SDs as well. Thank you.
I want to add something to what you are saying, Hassan. Sometimes, that is what I found in the exam when the role player also, after a while, some role players in the same station, because we used to have in-face exam and there used to be multiple rooms happening. So I gave the exam in London. So there used to be multiple exams happening in various halls, and the same station used to be given in one particular exam schedule. All stations will be the same. So in the same station, different role players will be behaving differently. When you talk to your friends that the same station, the role player was angry or a little upset. In the other hall, the same station, the role player was actually crying, and so they are also responding differently. In my station, I had a guy with male infertility, and this role player was quite bored with the exam, and he was actually just pacing about, standing and pacing about in the cubicle, not even sitting down. So you may face these circumstances. Now, of course, you have an online exam. The role player cannot go anywhere, but their expressions and behavior may be different from one role player to other, and how they respond to your answers may be different. So you have to modify what you're talking according to what you're listening. So unless you listen or you observe the expressions of the role player, you won't be able to respond. And if they're prompting you, that means there is something given in the script which you have not actually deciphered. And you can only decipher when you let them speak. That's what happens when you do the course. Many a time I try to get a word across, but the candidate speaking so much that I cannot get a word across. And unless I ask questions, so unless the role player asks you many questions, they don't know, they cannot judge your communication skills better. They cannot judge your knowledge better. So if you have answered the question of the role player correctly, one, it tells about your clinical knowledge. So one domain of applied clinical knowledge, and the way you have answered, that meaning by are you showing enough empathy? Are you, your tone of voice, your mannerism, are you attentive to the patient? This all things is a patient communication. This is all part of patient communication. So if you're doing all that in the station, even if you miss one or 2 points in the clinical knowledge, which may not be the buzz points which you should know, but some other points is okay. Still you will pass the station. And especially as we are talking about the lame examiner station, they are going to watch that only. So you have to modify yourself. So I'm saying don't stick to fixed notions of a station. Do not stick to that. You have to modify. It has to be a conversation. It has to be like, a same scenario, subfertility patient, for example. If you see in your clinic only, some patients will be very sad, some are very depressed, some are very frustrated, some are okay with it, some take it positively, some are very negative about it. So, and you deal with all these kind of people differently. Similarly, in the exam scenario, the same station, the role player, the same question in different exams, you may know that it's a recall question. Okay, this has already come in the exam, but it may be different. The role player script may be different. Small things may have tweaked. So unless you get that idea of the mind that it is the same station, of course, if you have read about that, that's good. You have clinical knowledge about it. But deal with the station as you're dealing with a patient. Don't deal with it as it's only a task in the exam. So I'm so sorry, I have to move out. It's around 12 here, and I have an early morning tomorrow. So thank you all for joining. If you have any questions, you can message us through the MedExam Expert. We'll try to answer. My friends will carry on with you. And I wish you all the best for your future preparation. And I'm sure all of you are going to do well. You just have to follow the basics, have a strategy, and be calm and confident in the exam. Thank you all. Thank you all. Good night.
Thank you so much, Pooja. Good night.
Thank you so much, Dr. Pooja, for your valuable input. Thank you so much.
I had problem of shortage of time in the reading the brief. I missed many points. See, you know, if you have shortage of time in the reading the brief, so what you can do is that even if you haven't finished your 2 minutes time properly, so you can take, you know, a small, you know, the permission from the examiner or the role player, and you can, you know, again, look at the examiner questions. Those 10 minutes are yours. Okay. So you can utilize according to yourself. So there is no harm. Even in real exam, even in online exam, you know, you will have, you know, the opportunity to utilize your cursor, okay, and you can just, you know, scroll it like, I mean, up and down the question as well. So don't be upset about it that you haven't read anything in 2 minutes time. Okay, you can finish it in like, I mean, in next 1 minute or say 30 seconds, 40 seconds, or and I mean, whatever time you want to take. So just don't forget to take permission. Okay, you can just say that you will enter, you will introduce yourself, and then you can say that, excuse me, sir, can I mean, look at the question again? Okay, so if you don't mind, can I look at the question again? So it looks very polite. Okay, it looks very good, in fact.
You know, Dr. Zaib, it's very critical point also is to how many candidates has a courage to stop the station at some moment and to start again if they thought that they are not on the true pathway or they cannot focus on the target of the station. This is very important to waste 2-3 times in reading properly and then start station in a very perfect way is definitely better than spending 10 minutes saying rubbish away from the core of the station. So sometimes you read the station from outside, and when you get inside, you have to start rapidly because I have only 10 minutes to finish this station. So, but I couldn't remember the details of the scenario. You have to take your time. Read the scenario once, twice, 3 times. Spend 2 minutes outside and 2 minutes inside the station, and then start. But once you start, you have to perform perfectly, okay? This is better than wasting 10 minutes in a very bad performance. And believe me, Dr. Zaib, you know this very well. Competent candidates should finish any station in average 8 minutes. In average 8 minutes. You have 2 minutes more, even 1 minute more than average. So 10 minutes is more than enough to finalize the station. 10 minutes is a good time by the RCOG to finish any station. This is not against the candidate. The time factor is beside you. So don't be anxious regarding the time. You always wasting your time by asking irrelevant questions, trying to explain in depth for the candidate, okay? And once you do these 2 mistakes, you will waste 3 to 4 minutes unnecessarily. If I'm going to take information gathering, for example, I'm not taking full history in details. I'm not doing that. The problem or the aim is to take relevant questions. Now, if you try to focus on relevant questions, you will finalize the information gathering in 2 minutes instead of 4 minutes for full history. The candidate or the role player is not and will never understand the medical details. So don't go in depth while you are explaining, for example, investigations or medical treatment or surgeries. You are the only responsible person for wasting time in this station because the time is appropriate. So read clearly, repeat reading, be confident, minimize unnecessary actions. You will find the stations, all of them can be finished easily in 10 minutes. And while you are preparing for the exam with friends, with groups, or in any course, train yourself to read in 1 minute rather than 2 minutes.
I would
And training table in the
yeah, I would beg to differ at this point, Dr. Hassan, because according to me, you have to read your station again and again, so not to miss anything in the question. Okay, in the 2 minutes time, what candidates do is that they do try to, think about that. How am I going to do inside? Okay, I'll be going inside, and I will start talking like this, like I have prepared with that person, like I have prepared with that person, like I have seen somebody performing like this. No, okay, what you have to do is that you have to read question again and again. Okay, you have to read question so not to miss anything if something is there. So I mean it shouldn't be like this. Okay, apart from that, just try to note down in your head that what exactly can be the important thing in that. For example, if there is a question and that starts with the age and the name, and then and forget about it that in the previous station you have seen any Daisy, and in the next station you are seeing the Nancy. So perhaps you will be calling Nancy again, Daisy, 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 but when you realize that you are calling somebody with the wrong name, so you will excuse yourself there and then. Okay, you will say, I'm so sorry that I've been calling you this, that I can just ask, can I just ask your name, please? Okay, if you don't remember, or if you want to look at the question paper, you can see the question. Okay, so but my advice is going to be that in the 2 minute time, do read the question again and again. Okay, don't try to make keys in your head that I will go inside, I will start like this, okay, I will be talking like this, I will perform like I have performed with somebody else, I will just say all these things and bingo. Okay, no. Okay, like we have been telling since our start of our session that you have to be very spontaneous. So be spontaneous, be yourself. Okay, don't just try to rehearse whatever you have rehearsed before this exam. All right, so I hope I have made this thing clear to all of you. If there is any other question, so okay, regarding S bar in the Gynae board, okay, I think Samreen has asked that question. So regarding S bar tool, see, in the Gynae board again, if you want to go about Gynae board, so what you have to do is that don't try to bring each and everything in one case. Okay, there are going to be, the certain, the key points in that. For example, if there is a huge fibroid and the patient is due for the, the myomectomy, for the huge fibroid, what we do is that we do go for pre-op, DNRH analog, isn't it? So if you haven't said that, so perhaps, that is the key, and you can miss that point. Okay, so if the person is having the high BMI and she is due for any the kind of procedure which can put her into going into the post-op the thromboembolism, so you can say that if it is a non-surgical, if this is a non-emergency situation, so I would like to discuss this case with my consultant, and I can just I can just ask him, or I can just discuss postponing this case until patient's the condition is stabilized, and if she is in good position to go for this thing. This is my saying. Okay, and this is not always that you will go like S bar and you will be talking about, okay, situation is that. In situation, what candidate do is that they will repeat the question again. So even if you want to go with S bar tool, so you have to pick the positive points, and then you just have to say that. For example, this is 36 years old. She is para 2+1, and she is here with heavy menstrual bleeding for the last 2 years, and now she is on list for so on and so on. That's it. So what you do is that you will repeat the same question. So this way, I think you are losing the time. Okay, many candidates do the same. Even with the S bar, do try to give positive findings only. Okay, not the complete. Don't narrate the complete question again. So this way, you just lose the time. All right. I hope I'm clear. Is there any other question?
Hello.
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 Yes, Hussam. Yes, Hussam.
First of all, thanks for your interesting and beneficial lecture. Just I wanted to ask about two questions. I know that we are in short time and the exam tests our skills and the communication, but how in this short time we can update our knowledge regarding recent talk, recent guidelines? What your advice? The first
Okay.
question. Second questions, I think due to the recent changes in the exam, I think that in the teaching modules, you may have some advice to us to pay attention to some station, because I don't think it's logical to bring in the or face in the exam a station like how to teach a junior doctor something like how to deliver a breach or forceps Leipzig. I don't think it will be logical in the exam. I wanted to ask about these two questions. Thanks.
Okay. Thank you so much, Hussam. Yes, both questions are very valid, and I appreciate we have asked these questions. Okay, regarding your first question, okay, how to update your knowledge. If you have passed your exam, I think, I mean, 2 or 3 years ago, so I will advise to refresh your knowledge, okay? Regarding recent talk articles, just scan them, just scan. If you find that if there is any, the important talk article which you think that you have to go through, just go through. With regard to the guidelines, I think there are no any new guidelines, rather amendments. Okay, like, I mean, in the recently we have diabetes guideline, okay, with few amendments in the GTM. Then we do have, the preterm labor. We do have intrapartum care guideline. Okay, so just go through, just quickly go through the changes. Okay, because you already know, I mean, the major part of the guideline. All you have to do is that what exactly is new in the 2021. That's it. All right. But be extremely careful with the old knowledge. Okay. Don't try to bring that old knowledge into this exam in 2022. Okay, so I will advise that just go through those important points, and with regard to the talk article, just scan the topics. If you think that if there is something interesting that should be done, so just do it. But otherwise, don't unnecessarily focus on the all talk articles reading. And from where do you get the the practicing station? From nowhere. Until and unless if you are learning something from your mentor, and probably he or she brings something new, okay, out of that talk article. So I won't usually recommend that go for that.
Do you recommend us to follow what's in the RCOG website? I think there is an item called the news. It displays the up-to-date articles and the topics, something like this.
No. Don't go. Okay. We already have the set syllabus. We know the curriculum from maternal medicine. Look, thalassemia, sickle cell disease, diabetes, hypertension. Okay. The von Willebrand, the cystic fibrosis, asthma, and what else? These things are going to be the hot topics, isn't it? So if you miss any of these, so probably you are missing a bulk of the maternal medicine module. So just focus on your major bulk first. And if you have covered almost 70 to 80% of your syllabus in 1 month or 1.5 months, because we are just close to February exam. So I think there is no need to go through the unnecessary stuff. So I think you can do it very well.
Okay.
Okay. With regard to your teaching, yes, I was coming to that. Thank you. So with regard to your teaching stations, what I can say is that it looks very illogical that we do have to do this. We do have to go for the drills. Yes, I do agree. Okay. But on the other hand, this is our job as a candidate, that we should be very well versed in each and everything. So I think this is very important, that we should be knowing each and everything, because in the real exam, we don't know from where the question will come. Although we have this notion in our mind that, okay, if we have to do something on mannequins, if we have to do something on, any, like, I mean, in the physical exam, okay, on the mannequin or any kind of, the procedure kind of thing, okay. So yes, how can we do it on the online? But yes, I do agree that, I mean, it looks little illogical, but on the other hand, as an exam candidate, I will never say that, okay, do skip those things. But yes, on the other hand, in online exam in teaching module, you have to be well versed in OSATs, okay, bullying, teaching, okay, bullying, teaching, the something which can be done online, okay, the teaching, the referral letters, okay, the what else, the discharge paper note, okay. So all these kind of the other things you can, I think, master on. Okay.
Okay. The last question.
Mm-hmm.
I'm still confused between choosing courses, the type of courses for preparation, because we are since a long time we are listening to lectures, and most of us already took some courses. Is it beneficial to take a course preparation course as usual, or we take that like what's called the mock exam station? You are exposed to the examiner, and he will examine you as if in the simulating the day of the exam. Or do you recommend us to take both of courses or one of them? And do you recommend us to prepare ourselves, for example, 1 week, 1 month, 2 weeks before the exam, that when we are doing performance with a study partner, to do that 14 station once during revision?
See, Hussam, I very well understand what you're coming from. With regard to this question, this is a very valid question, in fact. Okay, so if you have already taken, the plenty of courses, so you already have background knowledge, so you already know that how, the exam goes and how courses goes. And with you yourself said that, taking a mock can be a good idea. Okay, so what you can do is that, if you are already prepared, if you are already into a flow of this exam, so you can take mock exams. Okay, so mock exams can help you. Mock exams can give you an idea about, how you can go in this exam with well prepared, because in the end you need, some kind of brushing up from, any kind of mentor. So if you can take 1 or 2 mocks, so I think this is going to brush up your knowledge, and this is going to brush up your, the communication skills as well. Okay, but on the other hand, taking a full course or perhaps a crash course can help you with, or perhaps a mock exam itself can help you with this thing. Okay, but not the long course. But I think that, it is, but it is for the people who are already in this, the preparation phase. But for the people who have just gotten the seat and they haven't started their preparation, then yes, they have to start it from scratch. So they should know the ABC, they should know the complete, the sense of this exam, that how this exam goes and all. Sam, am I clear?
I'm clear, but okay, I'm asking about the type of performance. When I'm studying with my study partner, should I try myself or train myself to do more than one station or station by station?
No, see, what I always recommend to all my students is that it's better, and it's a very good idea that you perform and that you prepare 4 to 5 stations in a day. Okay, so what happens with that is that you are revising your guidelines. Okay, in terms of those 4 to 5, you're revising your patient information leaflets, you are making your own points. Okay, and then you are rehearsing with your study partner. So this way you are revising, this way you are, improving on yourself, this way you are reading your patient information leaflet. So by the end of the day, you're not going to think that I have wasted my day. Okay, so you can do it, and that's absolutely fine, and this is how it should be done. So gradually, close to the exam, almost like 10 to 15 days before exam, so increase in the the practice time, and increase in the practice in the numbers of the stations as well. They take it from 5 to 10 in a day. Okay, so this way, you are going to be in a good flow, good position to talk about, and yes, out of those 5, that can be from, the one module only, or that can be chosen from different modules, 5 stations. That absolutely fine. Okay.
Okay.
Okay, great.
Thanks a lot.
Welcome. Any other question, guys? Samreen, have I made myself clear to your question regarding labor board and gynae board? Neha, yes, Neha.
Ma'am, regarding labor board prioritization, when I was giving the exam, my examiner was like, when I was saying that I will send my midwife to this room, so she was already saying that midwife is already present here. What else you will do? So I was confused because ideally we have to allot every room to other person who according to their capabilities. So I didn't know what to say, so I got confused at that time.
So can you please give me a brief idea that, I mean, what exactly was
Like,
the
ma'am, the
situation?
room was not emergency. That is, if in the case of routine case or in the semi-emergency case, I was saying that I will send my midwife so that so that the midwife will take the vitals and also will do the CTG, and then she
Okay.
was saying that the midwife is already present in the room.
Then you can say that, okay, I will come to this room once I have finished my all emergency rooms. So
Okay.
perhaps, you know, she wanted to listen to this, because at the
Okay.
end, this is your labor board and this is your responsibility, that you have to manage all these cases, isn't it?
Yes, ma'am.
So
Yes,
in
ma'am.
every cold case which is not emergency, what you have to say is that, okay, so I will be coming to this room once I have finished my all rooms, okay, or when I have dealt with my all emergencies, my urgency cases, and then I will come to non-urgent cases. Okay, so perhaps she wanted to listen to this, and this is the idea of this exam, labor board.
Yes, ma'am.
Okay.
Yes, ma'am. Yes.
Okay,
Thank you so
okay,
much,
great.
ma'am.
Oh, so don't forget it. This is a very,
Yes.
I mean, useful tip, and we have to use it in exam as well. All
Okay,
right?
ma'am. Okay.
Okay,
Thank you,
okay.
ma'am.
Any other question?
Hello, hello.
Yes.
Just, I think this question is too early because I am talking about the days of the exam. Do you recommend that if someone of us his exam on the last day to follow the type of question came in the previous exams?
No, I never recommend, because this way you are going to be focused on only those questions. Okay. So at all times, you know, you have to be very open-minded about your preparation and everything. So what happens is, and this is psychologically, you know, a kind of a true situation, that we will be seeing and we will be practicing only those questions what have come on, you know, the day one, and your exam is on last day. Okay. So don't do this mistake, because what I have seen in this November exam is, I think the exam was like, I mean, 6 or 7 days across the globe. So many stations were different, and even the stations pattern were different. If you guys have collected the data, or you have, you know, some kind of knowledge about that, in some, you know, the centers, there were 7 role players, 7 structured discussion. In some stations it was 6 to 8. In some it was like 9 to 5. Okay, like 9 role players and 5 structured discussion. So it's never the same. Okay, it's, and exam is not going to repeat in the same exam. Okay, so remember this thing.
Even
So
if the one of the station is a topic is recent and very new, for example, it doesn't differ one station. Just I focus on my
no, they
study.
don't.
And
Yes, yes. If your concepts are clear, if you are confident enough in your preparation that you will say that Alhamdulillah, I have done what it needs to be done for this exam, then you are good to go. Don't be dependent on anything, any set thing, you know, or any other thing, what candidates are coming, you know, from the exam hall and they are telling you something. Because, you know, that is a very, you know, a very different aura. Okay, because when we come from exam, okay, let me give you an example of my, you know, we had an reflective practice station. Okay, and that was ectopic pregnancy, and the candidate, like Pooja said earlier, that, you know, probably, you know, because the same role player was behaving, you know, very normal to me, and he was just showing little concern that, you know, one of my senior consultants is giving me, you know, very hard time in my ward, and you know, that's why, you know, I was mentally upset and I missed this ectopic pregnancy and this and that. So when I came out of the exam hall, so when I discussed it with my friends, so I said, you know, I didn't find any kind of element of, you know, the so much of mental stress, and so I have to give, you know, straight away, you know, to go for the bullying or undermining, but it was straight away reflective practice. Okay, But half of the candidates were saying that it was a case of bullying and undermining, and half of the candidates were saying that this was the reflective practice. So everybody has a very different, the kind of perspective regarding, the station. So I won't say that, blindly follow those questions. But yes, if you have gathered, if you have seen, that is okay. So you can just quickly go through those, because by the time, when exam is, very near, so you will be in the flow that, you can revise, multiple stations in like, an hour or so. So I don't think that's going to be very difficult for you. I hope you
Okay,
got
thank
my
you.
point. Okay.
Thank you.
Okay, Hussam. Okay. So any other question? So Dr. Hassan, do you want to add something? Yes, exactly, Dr. Sahana. Every station is different for every candidate, in fact, okay? Because we perceive very differently. Everybody has a different vision to see the exam and exam stations, okay? So all of you guys, who couldn't be able to make, this time, so don't lose heart, be brave, we are living example in front of you that, we have failed this exam, we have passed this exam, and see now, where we are, in the RCOG. Okay, I'm an examiner, Dr. Hassan is an examiner. So nobody is asking us that, hey, look, you have failed this exam, so you can't be an examiner. Hey, look, you have failed this exam, you can't enter into RCOG building. Okay, so this is not a criteria, and this is not going to make you, the less capable and the less, the kind of a good candidate for this MRCOG degree. Okay, so don't be upset. Okay, just dust up. Okay, and just like, brush up and get up. That's it. Okay, this is your life. Okay, this is your exam. Only you know how to deal with it. Okay, just reflect back on your exam, what exactly has gone wrong and what could have been done, and so don't repeat those mistakes again. Okay, all right. If you guys need any kind of the guidance in terms of exam, pattern of exam, you can write all of us individually, or you can even write to our team as well. So we will be happy to help you, wherever we can. All right. So if there is no question, so I would like to take
Hello?
leave. Hello. Yes.
Hello, I'm sorry, just last questions. In
Yes.
exam, should I stick to the rules and the guidelines? For example, if I'm practice in UK for a while and I saw some practices or some department policy, should I expose this experience to the examiner to give him impressions that I'm working in UK? For example, in some hospitals they stick to certain antibiotics prophylaxis. Second example, in managing diabetes mellitus, many hospitals in UK now are following those uncontrolled or fully controlled diabetic patients to give them insulin infusion pump, and they even nowadays there is some certain programs and the consultant and the patient can go access the computer and adjust the doses, something like this. Or just I
No, no,
stick to
no.
what I know.
Listen, Hussam, in exam you have to be
And for
very
example,
neutral.
I saw in UK they giving as active management of the third stage of labor carbitose long-acting oxytocin. In some hospital, it's as a routine, not as we know oxytocin. Should I say something like this if
No, no, no,
I'm
no.
talking?
You have to stick to guidelines, okay? Or if you are
Okay.
very much skeptical about something, so you can say in that case that I will be following according to the departmental protocol. That's it. Be neutral, okay? So don't say that in my hospital it is used to be like this, and my hospital I have seen, this trust is doing this. No, you don't have to mention anything in exam, all right? So you can just say if you are very much skeptical about something, so you can say that I will be dealing with this patient, or I'll be managing this patient according to departmental protocol. That's it. Okay.
Okay.
Okay. All right. So thank you so much, guys, for being patient and being with us. Okay. So I hope so we would have been little help in your preparation or something. So if you guys need any kind of help, any support, so you can always write to us. All right. Thank you so much, Neha. Thank you so much. I really appreciate. And Neha, Suhana, and I think one other candidate, who lost this exam earlier. So please don't lose heart. Just stay strong. Sri, yes, you as well, and Soumya. So you guys need to be very much strong, okay? Dahlia and Samreen as well. So don't lose heart, okay? Don't make yourself, in such a situation in which you will pity yourself and you will think that you cannot pass this exam.